Good afternoon and welcome to our daily update, our weekly update for COVID-19 here in the Tri-County region. I'm Monica Hendrickson. I'm the Public Health Administrator here at Peoria City County Health Department. For today, Peoria, Tazewell, and Woodford County are reporting a total of 11,779 cases. Again, that's 11,779 cases to date in the Tri-County. That's a 2,127 case increase from this time last week. Peoria sits at 6,469 total cases, an increase of 1,019 from last week. Tazewell is at 4,160, which is an increase of 856 from last week. And Woodford County is currently at 1,150 cases to date, an increase of 252 from last week. Overall, there has been 181 deaths in the Tri-County attributed to COVID-19, an increase of 18 from our previous week. That includes 94 for Peoria, 67 for Tazewell County, and 20 for Woodford County. Today, we are saddened to report 3 additional deaths in Peoria County. The first is a male in his 60s, not associated to a long-term care facility, a female in her 70s, also not associated with a long-term care facility, and a female in her 90s associated to Bickford Nursing Home. Tazewell County is also reporting 2 additional deaths, one a male in his 70s and one a female in her 80s. Both did not reside in a long-term care facility. Overall, 73.6% of our cases are considered recovered, while a growing number is home and isolating at 23.9%. We're just under 1% at 0.75 that are currently hospitalized. Again, to give perspective, in just 1 week, the number of cases over a week span was 1,237. And as I reported earlier, we now added 2,127 cases in the Tri-County in just 1 week, doubling it. Our 7-day average daily increase in the Tri-County now is at 304, which is about double that from last week. In regards to our hospital data, OSF St. Francis Medical Center, UnityPoint Health Peoria, which includes Methodist, Proctor, and Pekin, currently have 34 ICU beds in use and 128 non-ICU beds in use, and reporting 1 death in the past 24 hours. With a total of 162 beds in use, this marks the highest number of hospitalizations our hospitals have seen since this pandemic began. We are now averaging 33 ICU beds daily and 94 non-ICU beds daily. This is not sustainable. If we continue on this path, closures will be the least of the worries for this community. More pressing will be increased mortality or deaths, further health complications, and the overwhelming of our healthcare system. Today, we're here to thank the tireless work of our frontline workers who have given more than just their time and skills. They, like us, have gone through a lot of personal and professional challenges and continue to sacrifice. So let's truly thank them by wearing masks and socially distancing. To speak more to this, I'd like to introduce Dr. Keith Knepp from UnityPoint Health Peoria.
Good afternoon, everyone. I'm Keith Knepp. I'm the Regional President and CEO for UnityPoint Health in Central Illinois. I'd like to start this afternoon by reading a joint statement from our regional healthcare organizations. Peoria healthcare and community health leaders unite during this global pandemic to share a common message of gratitude to the healthcare workers, frontline workers, and the community at large who have endured great change and sacrifice in all aspects of our lives. This is a message to Central Illinois. We see you. We appreciate you. And together we will weather this storm and emerge stronger. As we prepared for this pandemic in March, Our respective organizations came together to share strategies and information for the betterment of our healthcare workers and community at large as we prepared for the unknown. Today, we want to come together again to say thank you. Thank you for wearing a mask. Thank you for physical distancing. Thank you for doing your part. With the season of giving fast approaching, the best gift you can give your loved ones and your community is to stay vigilant. In order to ensure our medical facilities have the capacity to continue caring for patients in Central Illinois, please continue to wear face coverings and practice physical distancing. And when making plans to celebrate the holidays, please consult guidance from the CDC and the Illinois Department of Public Health for those holiday gatherings. I want to emphasize my appreciation to the entire community. I've seen this community come together. Most of all, I want to express appreciation to healthcare workers. And I want you as a community to hear from us as healthcare leaders that your healthcare workers are feeling the strain. This feels like the spring all over again when we felt the urgency and the challenges of a new pandemic. You know what's different this time? We're a lot more prepared. We have tools, we have PPE, we can test a lot more people, we know more about this disease even though we don't have a cure. What's different this time is the numbers are so large. The numbers you just heard, we have 3 to 4 times the number of patients in our hospitals than we had back in the spring. And yes, we still have some beds available, some ICU beds, some ventilators. We haven't tapped out our physical capacity. But we only have so many staff, and we only have so many ICU staff and respiratory therapists and critical care physicians, and the whole country's facing this. I don't know where we would find more. And our staff was tired coming into this. They've been working long hours through this pandemic. So they need your support. We need your support. If we're going to make it through this together, we all have to do our part so that we aren't overwhelmed with more patients than we can care for. So again, we express our gratitude. Let's remember, we are not the enemy between ourselves. This virus is our enemy, and we need to come together to conquer it. So with that, I'd like to turn the microphone over to Bob Anderson, President of St. Francis.
Thank you, Keith. Thank you, Monica. I too would like to thank our healthcare workers, our providers, and all the specialists that have really been tirelessly fighting this virus for the past months. Our healthcare systems are ready and prepared to care for those in our community, but we need the community to do its part as well. We're getting ready to enter into a long winter season, and we're all tired. We're tired of the pandemic, we're tired of masking, but we can't give in to pandemic fatigue. We must continue to follow the 3 W's. Remember to wear your mask, wash your hands, and watch your distance. Each hospital has emergency operations plans that it uses to prepare for situations like this. Those plans include how we surge our capacity so that we can care for more patients than we normally do. But those plans require us to have healthy staff available. And as Keith just mentioned, if we don't have the staff, we run the risk of not being able to meet the needs on a timely basis that our communities have. At this point, we're doing okay, but we need to remain vigilant. I encourage everyone to take advantage of virtual health technologies, digital health assistants, websites, and to reach out to their primary care physician if they have concerns, and to use those digital mechanisms before they go to an emergency room to seek care. It helps us to triage your needs and to make sure that you get care at the right place. With that, I'm going to turn things back over to Monica so she can handle any questions you might have.
And just before we go into the Q&A, I just want to reiterate, I know yesterday Illinois Department of Public Health asked everyone to think about the next 3 weeks and what you can do additionally, and really focus on the fact that if we do a concentrated effort to tackle this problem, that means limiting our activities to those that are essential, that there is a chance for us to get around over this and be able to head into the holiday season, which actually kicks off this weekend with Diwali and then moves into Thanksgiving and then into the Christmas and Hanukkah seasons as well. Again, if we want to try to get ahead of that and get to some normalcy, we really need to focus on the next 3 weeks as a state. So with that, we'll open it up to some questions.
For you, from a medical standpoint, your thoughts on the governor's mitigations, but yet it seems like a lot in the Peoria, East Peoria area are not following those.
So in regards to the mitigation efforts that have been pushed forward, specifically for Region 2, which is where Peoria and Tazewell counties are, there's been a lot of focus, I think, on restaurants and bars and whether or not they're complying or not complying. Here in Peoria, we do everything on a complaint basis. We use our Restore HOI website to log in complaints, and then we reach out and do education, because a lot of times it's just understanding the implications of when you don't follow the mitigation rules, what can happen in terms of licenses, whether they're liquor licenses, food licenses, as well as the DCO issued a lot of grants and funding activities. And so again, people really don't want to jeopardize that, and so a lot of it's just education on our part. But I can say overall, the thing that you can do as a community is recognize the fact that the virus spreads, and it spreads based on the concentration and volume of individuals. So by wearing a mask, and there's some great information now from the CDC about the importance that wearing a mask is actually really about you and others, but there's a lot more about how it can protect an individual. Likewise, that social distancing, you're going to be able to get ahead of it. So I know there's a lot of questions about the levels that people are following it, but overall, again, it takes a whole community effort on this.
You said over the past week you're averaging more than 300 new cases a day, and that's double what it was the previous week. In the past, you said if we get to 500 cases a day, that's where contact tracers can't keep up and it becomes an uncontrolled situation. If it doubles again, we're over 500. What steps do we need to be taken, and what can be done to prevent an uncontrolled situation?
So I think there's two parts to understanding the uncontrolled situation. One is the effectiveness of contact tracing. So local health departments across the state have been just increasing their workforce around contact tracing, as well as leveraging existing points of contact. So training, congregate living settings, working with our shelter population, our school districts, because a lot of them are the first line of defense in some of this recognition of who those close contacts are. But to really help our contact tracers and really control that number is exactly what we've been saying in terms of those non-pharmaceutical interventions and what both hospital systems have said today. It's you got to wear your mask and you have to maintain social distancing.
In terms of the surges in the hospitals, you all are most concerned about staff. You're not necessarily concerned about beds. I know at the beginning of this thing, you all have plans for if you need more beds. You've always had kind of facility plans, right?
Let me start by saying that staff is the biggest issue that we're facing. If we don't have the proper people, it doesn't matter if we have empty beds. Right now we're doing a balancing act of looking at the beds that we have and the resources we have from staff, juggling things to make sure that we have the right people in the right places at the right time. And as we said earlier, the challenge is if it continues to go in this direction, it will be increasingly difficult to do that, effectively.
How close, if you don't mind, why don't you say, then we'll go back.
Sure.
How close are you to getting to that critical stage?
It's really tough to predict because there are so many factors. I've had, on a single day, as many as 50 staff that have called in not because they have COVID, because maybe they have a child that's ill or they have, other reasons, but that creates holes in our day, and we have to fill those and we have to manage that. And a lot of it is the patient mix, who we've got in the hospital at the time and what their acuity levels are. So it's something that we monitor basically on an hourly basis, and we adjust throughout the day our staff and relocate patients when necessary.
Would you agree, though, that it's going in the wrong direction?
I would agree that it's going in the wrong direction in terms of, as been said, we have 3 to 4 times more patients in our hospitals with COVID than we had at the beginning of the pandemic.
Have used cross-training staff so that you can pull staff from other areas of expertise, or how hard is it to do that?
Cross-training staff is something that I think all the health systems look at doing and utilizing as much as we can. We do have areas of very specialized skill, nurses that do surgery, that are in the operating room, aren't easily replaced with another nurse that's cross-trained. But when it comes to ICU and general med care, we have more flexibility with cross-training.
So that's a good thing.
It is.
Okay. And did you guys kind of work early on to get staff cross-trained for this?
We've been preparing since February, and that's included things like cross-training, emergency staffing plans, relocation plans. All of that's been part of that emergency response plan that I mentioned earlier, and it's all been part of our ongoing preparations.
So you feel like you've kind of got everything under control, but the staffing thing is still an issue?
Staffing is the biggest issue that we face right now, and it's something that we work at every single day.
How much of that has been caused by people getting sick from COVID?
It's hard for me to put like a percentage or an absolute number to that. Obviously, you run into seasonality when it comes to people calling in, so there's some aspects that fall to that. A lot of the issues that we run into are people who have family problems that need to be off for a time. But it adds to that.
Have you had to, 2 more questions, then we'll continue. Have you had to consider reducing or eliminating elective surgeries when you said your staff is kind of maybe going back and forth?
We look at our surgery schedule on a daily basis, and we project we know who's going to need a bed and what level of care they're going to need. We are in close communication with our surgeons so that they're aware that if we do have to make an adjustment and delay or move a case from one day to another, that we can do that. At OSF, we have had the capacity to not have to alter our surgery schedule, but that's, I know, not the case throughout the area.
I'm sure you're doing kind of, but if you could, and with the numbers going in the wrong direction, anything special that OSF is doing to keep the hospital as safe as possible for patients and workers?
One of the things that we're doing is we're really emphasizing the need for people to be wearing masks when they're in the hospital, whether they're our own mission partners or whether they're our care partners that are in with our patients. We allow one support person to be with a patient to help with discharge instructions and that type of thing. It's very important that anyone coming to the hospital gets screened and wears their mask the entire time that they're within the walls.
One more question. I'm guessing you have talked with kind of the lead doctors and the charge nurses and all like that. What are they saying? Talk about those frontline workers. I mean, are they, I'm sure they've been fighting this or not fighting it, they've been trying to fight it off for, 6-7 months now?
Healthcare workers are people too. They get tired, they get discouraged, and we see that, and we support our staff. We work with them when they're down. And I know Keith has been taking some very specific actions, as has OSF, to try to support our ICU staff, our general medical staff that are working on the front lines. It's tiring. It really is.
I think we have about
One,
12 questions for you. But we can start with.
Well, just one comment I would make to add on to what Bob's said already. I think everything he's described is accurate for the whole community. But that is that one of the negative impacts of this pandemic has been people choosing to avoid care or postpone care who really need to have that done. So as was described, our work to make sure we have an adequate workforce does have surge plans in place, not just for space, but for staff. that means taking staff from clinic areas into the hospital, vice versa, and that can diminish access. What we're worried about is that people might choose to postpone coming in, though, for very needed care. So if you have a chronic disease, we have digital platforms, televisits, where you can still see your physician to get the care that you need. And if you have chest pain or stroke symptoms or trauma, our emergency rooms are open and prepared to take care of you. We're not overwhelmed with patients. So we really want to make sure the community doesn't have a message that the hospitals aren't here and able to provide necessary services for people who need care, because that's just as much of a negative consequence as if you have a poor outcome from COVID.
Would you say you're at a critical stage in beds and staffing, or just talk about that, and if we keep going in a bad direction?
I would echo what Bob has to say. It's really hard to predict. We are definitely feeling the strain, and we've had to activate our surge plans, both for space and for staffing. And no, we're not overwhelmed at this point, but we are feeling the impacts of both the increased volumes as well as the staff who have to be out for illness reasons or family reasons, as described.
Early in the pandemic, you guys kind of closed everything down. We focused on COVID. All of these routine screenings and things, everybody kind of postponed it for a while. Now we're like almost a year into this thing. And the fact that people have postponed things, we're kind of seeing the negative effects of that. Is that something that you guys are being very careful to address kind of this time around as we've gotten deeper and deeper into this thing?
Yes, one of the things we've done is we had to cancel procedures and screening tests early on in the pandemic is keep a record of all those patients who were supposed to have something done but weren't able to get it done. And so we've spent the summer months calling many of those patients back to come in for those screening tests, and we'll continue to do that work. Our screening work looks at databases, and we look for people who are needing that care. But our concern still would be people who postpone voluntarily things that they need to have done.
So your message would be don't postpone it anymore?
Correct.
Okay.
Yeah, if you're scheduled to have something, I'll just note my wife came in for a mammogram this morning. She texted me and said, hey, everything went fine. So those things continue. We're able to keep people safe through the measures that Bob described with restricting unnecessary visitors, keeping the environment clean, wearing masks. And if we get to the point where we need to curtail those services further, we'll do so for a period of time and let people know and then open back up.
Why would you need to curtail those services, do you think?
It would be if we need to divert staff to other things, or if we just decide we need to limit the number of visitors coming in or unnecessary individuals in the facility.
Okay. Do you see that happening anytime soon?
We will have to continue to look at our visitor policy. We have a similar approach across the community of allowing a support person to be there and to parents, families able to come in at end of life. But we still have a lot of people coming into the facility who aren't patients, and as community case rates rise, that brings its own risk too. So we'll look at that on a day-by-day and a week-by-week basis.
Concerns, thoughts about the upcoming flu season, what that could also bring for both?
Yes, it's always been one of our fears is that flu and COVID would coincide. I think what we've said all along, though, is the same things that prevent COVID prevent flu. So if we continue to follow good hygiene, mask, and social distance, we ought to be able to keep flu under control. And absolutely, if you haven't gotten your flu shot yet, please do that.
Any extra protocols you're doing at Unity Point to help keep the facility as safe for the patients and workers?
The same things that we've been doing since the pandemic started, which are screening visitors as they arrive, requiring masks in the facility, extra cleaning protocols throughout, and then limiting unnecessary visitors. All that are part of that plan. We've taken pretty strong efforts as well in terms of asking our staff to be careful. And so, we learned early on in the pandemic that social distancing doesn't just apply when you're out at a restaurant. It applies at the nurse's station or the break room or the waiting room too. So applying those things across all facilities.
Thank you.
I have another question for you, Monica, if you don't mind. You mentioned all the holidays coming up, especially with Thanksgiving just a little over a week away or 2 weeks away. What would your recommendation be for gatherings at this point with the surge and spike that we're seeing?
So I think recommendation in terms of gatherings for Thanksgiving, this is something that the state, as well as the CDC, knew what was going to happen. We were hoping that we would not have to necessarily be in a situation where we have to make difficult decisions, but being said that every region in Illinois is under some level of mitigation, I think it's important to look at alternative methods for celebrating with family and loved ones, whether it is virtual Thanksgivings, everyone in their own household, and again, a household is an address that constitutes a household. Trying different opportunities for that. And if you are deciding to travel, as a group, kind of make certain guidelines or principles. I think IDPH put some great ones. First and foremost, make sure you have your flu vaccine. That's really key. But then try limiting your exposure 14 days prior. Kind of create your own quarantine and then go into also getting tested maybe before you guys meet. It's not going to look the same. And I want to reiterate, no one's telling you to cancel Thanksgiving or cancel celebrations. They're really important, especially around mental health and fatigue. We're just asking that it's going to look a little bit different this year. And that's the key. Just, make a few changes. Think about doing it inside your house. And somebody made me a great point, which was, this may be the year that I don't have to clean my house for the first time for Thanksgiving. So I'm taking the positive with it. Okay. Well, thank you so much. We'll see you guys next week.